Oh, thank you. I've been in Washington, D.C. with Secretary Kennedy the past 100 days, and I can tell you it's a very dark place. It is so enriching to be here and try to heal from the PTSD. And I'll tell you what, on this topic, I think it's very apt because it is so clear that there are so many forces at work right now, and I think this is one of the most important dynamics in the country that we face. There are so many forces to convince us that our common sense and natural intuition isn't right. And when we talk about what doctors can't do, I think the foundational premise of what Secretary Kennedy is bringing to light, what we're talking about culturally right now in the country, is that 95% of where we're spending medical costs right now are fundamentally chronic lifestyle conditions. And these are fundamentally not conditions that are medical conditions. There's something happening to us. There's something poisoning our cells. And that medical system, that 95% of medical spending right now, is predicated on somebody being sick and managing that condition, not curing that condition. And getting to D.C. and as Secretary Kennedy walks into the HHS, it's extraordinary. I mean, his department, it's the largest largest budget of any government department of any government in the history of the world. It's the biggest department in the U.S. government. Just the healthcare expenditures alone are 28% of our budget, the fastest growing part of our budget. Military and defense spending combined, and we spend more on that area than any other country in the world combined, is 11% of the budget. So we're 28% of the budget. And all of those incentives are predicated on medicalization, predicated by us being sick. And, when I think about this struggle we're in right now, where we're getting so sick, we're living 7 years less than people in many European countries. We're spending 4 times more per capita than people in medical countries. There's this unrelenting effort to convince us that that's a medical problem, that the people in the building that Secretary Kennedy's managing, every single person, has been evolved and nurtured in this system that says, how can we slightly change medical policy? How can we slightly get more reimbursements, those fixed to Medicare and Medicaid? How can we just incentivize the insurance companies, the hospitals, the doctors, the pharma companies just a little bit better? It's all incremental. With large healthcare conferences you go to, everyone has slides about how if we only changed the reimbursement incentives just slightly, everything is going to be fixed. And I think what we're grappling with right now, and I know so many here people realize, but hopefully I'll shed a little bit of light how this actually is working in D.C., is nobody understands that it's not a healthcare policy issue that we're facing. It's not an issue that's going to save us of how to slightly tweak the healthcare incentives. The key thing we're grappling with is we don't have a healthcare policy issue. Europe has very bad healthcare systems, socialist systems. They're not systems of healthcare delivery that we want to emulate. The problem is that they're not being as poisoned. We have a poisoning issue in this country. And that is something that the swamp does not understand. I mean, how I've come to this is through my sister, and I think it's very telling, but her story changed my life. We were raised in Washington, D.C., and I was so proud that I had a sister that went to Stanford Med School, researched at the NIH, went to surgical residency. And it was appalling to me at the time that she was saying these hippie ideas about all of her patients under her knife. She was doing sinusitis surgery, just day after day after day, cutting open their face because their sinuses were so inflamed. And I thought that was heroic. I thought that was great. And she said that she started studying about nutrition, started studying about environmental toxins, started studying about sedentary lifestyle, started studying about how these patients were over-medicalized and how those conditions might be impacting those patients' cells and leading to the inflammation, and how she read their charts, which she wasn't even supposed to do, and saw that her average patient had 6 other comorbidities on average when she did a surgery on them, that they were inevitably seeing an endocrinologist for diabetes issues, a cardiologist for heart issues, a psychologist, psychiatrist for mental health issues. And she started trying to piece together whether these items were related, whether they were related to a deeper root cause. She started reading nutrition research and literature and started talking to her patients about nutrition. And she was reprimanded by her attending surgeon. And she was actually told at one point that she didn't go to nutrition school and that she wasn't to talk to her patients who were so inflamed that they had to have their sinuses cut open about what they're eating, about other environmental issues for them. And it woke her up. And she abruptly left the system. I mean, we were so proud of her. The family was so proud. She was the star of the family, and she had this insight. And the insight, and the topic of what doctors can't do for you. There's so many incentives to tell us things are complicated. And her insight was actually, that reading a blog post by Joel Salatin, or a book by Dr. Mark Hyman, taught her more about what's actually happening in our bodies and how to reverse and cure disease than 4 years at Stanford Med School. And she really meant that. She learned nothing in medical school about what actually causes disease, not one single class on nutrition, not one mention of exercise, not one mention of environmental toxins. I mean, it's talked about a lot, but I think it's extraordinary to really grapple with that. Doctors today, by many measures, 80% of their entire course load is in pharmacology and other types of interventions that accept as a predicate, accept as a fact that the patient is sick. There's no discussion at med school about what actually causes people to get sick. The medical system accepts that as a given. There's nobody in the ranks of HHS asking the question until now, why are people getting sick? It's all accepted, and that's a very convenient framework for a system that is the largest industry in the United States and is predicated at every single level, not conspiratorially saying this, just as a simple fact, every single level of every single institution that impacts our health makes money when that patient is inflamed, when that patient has oxidative stress, when that patient is depressed, when that patient is already sick. The pharma industry makes money when interventions happen. They don't make money when a child is thriving. They don't make money when a child is eating healthy food. The hospitals make money, and you hear this time after time. They make money when the beds are full. I've got friends from business school, good people. They work in hospitals. They have quarterly numbers to hit, and the core line on their spreadsheet is how many beds are full for how many nights. It's their fundamental metric of how they're paid and how our system incentivizes them. Insurance companies make money when people are sick. By law, insurance companies can only take 15% of healthcare premiums, but they're allowed to raise premiums. So their fundamental incentive is for premiums to raise, which they have. They're the largest source of U.S. inflation into healthcare costs. And insurance companies have got 15% of a higher and higher portion of premiums, which means more people are getting sick. And Casey, that simple point, which took me a lot of education, I'm like, it can't be this simple. It can't just be about these root cause habits. What did you go to med school for? And that to me is a profound insight. It's what Secretary Kennedy's talking about. And it gets to I think, a really spiritual reckoning that we're having in the country. I think many people in this room probably understand that. This is not about listening to your doctor more. This is not about that new drug innovation is going to turn this tide. It's not about paying more money to doctors or listening to doctors more. There's a fundamental mistake we've made as a country, quite frankly, that we've listened to doctors too much when it comes to chronic disease, that we have trusted the medical system too much to take leave of our common sense, to take leave of our own intuition. And that's a very, very disruptive message. And, I'm seeing it personally with my sister, who was nominated for Surgeon General. And it even surprised me. It hasn't surprised her, and she's very spiritual and in such a great mood. But I'm used to a lot of energy around what Secretary Kennedy's trying to do, but just personally seeing it, the venom from the medical system, that this doctor who left the system could possibly be equipped to talk to Americans about health, and the attacks on her for being a traitor, for leaving the system. it really is powerful to me. And I think it does grapple with a foundational question we have in America right now, because that's the point. We need somebody who's questioning the system to be giving us medical advice. And that is so disruptive. And what Secretary Kennedy is doing in this conversation, that maybe the answer to what's ailing us is not in the pill bottle, is not based on the best possible research from doctors. That's a very, very disruptive message to many, many people. When we talk about listening to doctors, what doctors can or can't do, I just have to tell you, one maybe not surprising but startling insight from working to do whatever I can to support Secretary Kennedy in DC. And I know probably many people here are very excited about things happening. Maybe some people think more things should be happening. I feel the same way. We want to move as fast as humanly possible. But I really do see things in terms of forces. And it really does feel like he's up against a predominant portion of the U.S. economy. And when he takes on any industry or any effort to reform how we think about health, less from this fragmented view where Casey, at the end of medical school, had to choose between 42 specialties and then 82 subspecialties after that, and we divide the body into all these different parts and medicalize it, and the endocrinologist isn't talking to the cardiologist. This world of that to a more simple world, you feel the force of the disruption to any of that with the lobbyists and the CEOs who come into the building and talk, and it's extraordinary. I mean, I've recently met with the largest food companies in the world who have piles of academic research in 2025 and are aggressively arguing how sugar is not tied to bad health conditions and how it is okay that sugar consumption has gone up 70 times among children, 70x, in the past 150 years, and how that's not scientifically proven that that's harmful for their cells. That is an argument people make with straight faces. Some of the largest companies in the world are aggressively making the argument to this day that ultra-processed food, it's not clear whether that's harmful for children. Today, the USDA guidelines, they're being updated, but today, the previous USDA guidance has been that it's inconclusive whether ultra-processed food, which is now 70% of a child's diet, is harmful for kids. It was 0% 70 years ago. It's 15% in France and Spain for a child. It's 70% in the United States. And there's aggressive arguing with peer-reviewed, gold star scientific studies that they have where they are arguing that it is fine for kids to be eating. And directly, not subtly, but directly, that argument and that science, and we're lectured all the time in this building about needing to stick to the science, the gold star science. They've got piles of peer-reviewed research on every argument they want to make, on why Ozempic should be prescribed to 6-year-olds, on why SSRI should be the first line, antidepressants should be the first line defense for a depressed 12-year-old girl. They've got reams of data from Harvard. They're lecturing us a ton about the science. But very close to that is a direct argument about jobs. And the fact that our system has gotten to this point, and the fact that our sick care system employs so many people, and the fact that our sick care system, it's predicated on so many mortgages and so many people having, their dignity and being able to work, that argument is directly made. And when you back up, of course, that argument's a little dark. It really doesn't try to engage on the actual health of the American people. It tries to engage on the fact that this system might be completely backwards, but it's so ingrained with the U.S. economy, we can't afford to do things to make people healthier. And that energy and that argument and the cards that industries have, given how many people they employ and how much money they make, is a very, very, very powerful force that can also be seen with the fact that a healthcare conglomerate is the largest employer in 60% of U.S. states. therefore the largest most important political player in 60% of US states, which then necessitates, of course, the impact on senators who have a large impact on how they call and how they engage the White House. So this is, and I think we all understand this is a very deep issue that we're just scratching the surface of, about really asking pretty powerful questions about foundational issues in US culture, I think foundational spiritual issues of where we've gone wrong, foundational economic issues, and it is foundational questions about transformations of the US agriculture system, of how we're treating and respecting our environment and its connection between our health and our food. It's foundational questions about how we think about doctors, how we think about healthcare. I mean, I think so many people here know this and feel this, and I think it's why Secretary Kennedy has resonated so much. There's much, much deeper issues and much, much more powerful conversations being let out of the box here than politics is used to having. And I do think that just speaking as seeing in there with Secretary Kennedy, it is extraordinary. He is a giant and a champion, and he is absolutely fighting. I don't think there's ever been an administration at the top, the key people at the top, including the president, who are encouraging him to move very fast, and he is working so hard with so much force behind him of voters and his support to chip this away. I think no matter what happens, this is such a deep and important conversation, we're going to just scratch the surface of the next 2 years. Because again, this is a full transformation we're talking about, I think, of US culture. But for me, if I'm honest, the most important thing is that the energy and this resonance, and if you feel that we're touching on this spiritual issue and this societal issue about how we think about doctors, how we think about healthcare, we need to continue that energy, because it's amazing when he's in discussions and there's that power of American industry and American jobs, and they're weaponizing the science to argue against clear common sense. What he has behind him is clear voter mandate. And he has, I honestly see an energy behind him of voters. And that, for the first time, somebody sitting at HHS, that allows him to win arguments. And that's just, frankly, I'm both horrified and inspired, honestly, because they say our democracy is the worst system except for all the other ones. It is about money, and it's about voters. And the voters counteract the money. And the fact that he has voters behind him, again, allows him to drive change, allows some great successes in those first 100 days, and allows him to be working with support to really untangle this. So I want to get in a little bit about what I've learned. And to me, the bridge we're trying to build, or the bridge I feel like this movement builds, of how we see the doctor, how we see medicine, and where we need to go. But again, I think the big lie in America when it comes to health is that health can be found at the doctor's office for chronic conditions. We talk about miracle innovations when it comes to antibiotics or procedures like with childbirth, if there's a huge complication, or with an appendicitis, or, it's usually, when you think about medical miracles, it's something that's going to kill you right away. And the American medical system is great at those things. I mean, if you or your child, I would argue, are imminently sick and acutely going to die with something, you should listen to your doctor. But I think what we miss is that is 5% of U.S. healthcare spending. 95% is chronic conditions, to where we have 4.9 billion chronic disease prescriptions written a year, and 35% of U.S. teens are on some kind of pharmaceutical chronic disease medication. And I think that is a result, and let's just call it what it is too much trust in the medical system. This is nuance, and there's many long tails of different outcomes and different scenarios. But fundamentally, if something is not going to kill you or your child, but it's more of a chronic issue that's going to nag over years or decades, I think we do need to have, and the country needs to have, more trust in natural outcomes, more trust in the root cause. And be asking, what's happening inside my bodies? How can I see this symptom as a gift, actually? What's crying out for help? Casey and I talk a lot about my mom, and it's a personal story, but I share this because I'm sure it resonates with a lot of people. But, she had an appointment at a top hospital in the Mayo Clinic. She was very privileged, and she got executive physicals at what by many measures one of the top hospitals in the world, and she was told that she was perfectly healthy. And at 70, she was on 5 chronic disease medications, and she was actually on less chronic disease medications than the average 70-year-old. And the doctor said, "You're doing great." And then she got a pain in her stomach, went in to get a scan, got a text the next day, and said she had stage 4 pancreatic cancer. And she realized she probably had weeks to live. And to me, what happened the next day when she went into top oncologist, top cancer doctor's office, just put this all together where the cancer doctor said this was unlucky. But it wasn't unlucky. The United States today has the highest cancer rates of any society in human civilization. Out of 212 countries in the world today, the U.S., that measure cancer, the U.S. is the highest. Among kids, cancer rates are off the chart. They're off the chart. We have the highest rates of pediatric cancer ever this year, and we're by far the leaders of the world in pediatric cancer rates. So cancer and these things that kill you clearly are downstream of something happening. And the tragedy here is that my mom had so many warning signs. I mean, I was born at 12, I was 12 pounds, 39 years ago. And my mom was high-fived by her doctors. But that's actually a clear clinical warning sign she was brewing metabolic dysfunction, and there was something actually going on in her cells. She had gestational diabetes, we think. It wasn't fully diagnosed, but there were signs of that. That's a warning sign. Often with fertility and pregnancy, there's actually warning signs, but she was told that's fine. It wasn't used as a signal of asking and spurring curiosity about what's going on inside her body. And then she went on the traditional pharmaceutical treadmill. She had trouble losing weight. They said that's normal. She battled obesity. She had high blood sugar. She was told by her doctor that 50% of her people her age have prediabetes. It's a pre-disease, no problem. Take the metformin. There's 90 million prescriptions for metformin issued a year. She had high cholesterol, no problem. That's normal. Statin's the most prescribed drug in the country. Take your statin. High blood pressure, no problem. ACE inhibitor, all 15-minute appointments. Literally, the guidance until 2018 from the American Diabetes Association was that if you take your metformin and take your diabetes drugs, you do not need to change your diet. The entire message, the foundational message with statins is that, you can eat whatever you want, just take the statin, you've lowered your cholesterol. Literally with Ozempic, the weight loss medication, the injection, they are arguing at Harvard from professors that are directly paid by the company that makes the drug that obesity is now a genetic condition. They literally have that argued. And they are arguing that aggressively to the Health and Human Services Department, because once you put a condition into a box that we can't control, then that buttresses the case for government funding of the drug. That's the miracle cure. And you have academic research, peer-reviewed research, questioning whether food is related to obesity. That is literally what is being talked about, because it can substantiate this cure. It never works. It never works. It's masking the symptoms. And that is how we need to look at chronic disease. We need to ask what our cells are saying to us, what our body is saying to us, seeing symptoms as a gift. And when it comes to potential root causes, again, things get very complicated. There's long tails. But I think Secretary Kennedy is right. I think Casey is more medically right than the doctors at Harvard and Stanford and all these fancy people who are saying it's complicated. There's this aggressive, you read any media article, it is just aggressive assault on what Secretary Kennedy's trying to do, saying he's an idiot because he doesn't understand how complex things are. That is a lie. Things are simple. The preponderance of why we're getting sick actually is much more under our control, and we can understand much more than any doctor will tell us. And I don't have hacks or miracle cures. I think the message from our government, the message for every family, should actually be these super basic things of looking at the core inputs that impact our beautiful interconnected body and spur each person on a path of curiosity to how those inputs could be potentially impacting our cells to spur symptoms and spur what is really an interconnected set of issues. I don't like even calling something diabetes. I think it silos it. 94% of Americans have signs of metabolic dysfunction. Diabetes is just one branch of that. 66% of adults have prediabetes. Almost the majority of Americans, actually close to the majority of teens, are battling blood sugar dysregulation. That's not a diabetes silo. I still meet with people at the NIH, people at HHS. They talk about diabetes like it's this isolated thing. They talk about diabetes spend as if it's, that's just $300 billion worth of spend. No. Almost the majority of Americans are battling some kind of blood sugar dysregulation. Diabetes is an arbitrary marker with no clinical significance of a blood sugar level. Somebody with diabetes has an average of 3 other comorbidities, other issues. It's an interconnected system. It's very connected to heart issues. It's very connected even to depression. It's very connected to kidney disease. It's very connected to the infertility. So the fact that we silo these things, the problem, if we can get to the root causes, we're going to get so much closer there. So just quickly, and again, this is simple, but when it comes to our food, there's clearly to me something very dark about what's happening to American food. It's inescapable, and it's only buttressed and reinforced by the absolute neck-breaking desire of the large industries that exist today to not want to have a conversation about food, and the pounding and intimidation to not open a conversation about food. There is a spiritual battle for us not to have a conversation about our food system. And I think all of us intuitively know that there is something going on with food. This is not about putting farmers out of business. This is not about calling farmers, large or small, villains. They're not. They're incredible people, and the success of the U.S. agriculture system must happen for the success of American health. But I do, and wherever you are in politics, I do think it is so admirable that the Trump administration is empowering Secretary Kennedy to open up this very, very complicated conversation about our agriculture system. And when I look at that, it's 2 things. Clearly, there's a problem with ultra-processed food, and frankly, the addiction of agriculture output creators, of people who farm on the ultra-processed food system. And to me, the foundational problem with ultra-processed food is that it is engineered to hijack our biology. It's engineered to hijack our biology. It's literally created by the cigarette industry. And I've talked about this a lot, but it just cannot be repeated enough. When your child is eating something in a package, that food has been created by the highest paid scientists in the country who in the 1980s worked at cigarette companies. The lineage is from that, because as cigarette smoking went down in the 1980s, the cigarette companies bought up food companies, and in 1990, 40% of the US food supply was owned by the cigarette industry. R.J. Reynolds and Philip Morris were the 2 largest food companies in the 1990s in America. And almost any brand you see on a shelf now has been sold off since then, but really originated from ownership of the cigarette industry. And they deliberately moved scientists from the cigarette department to the food department. And that's why I think these talk about our chemicals and they talk about ultra-processed food. The scientific debate, they try to get into, is it this ingredient? Is it this ingredient? Is it this chemical? We don't know. It's not conclusive. The problem is it's the mix. The problem is that we've allowed scientists to do literally like full-on studies of what makes kids want to eat more food. They put softeners in the food because they know if the kid chews less, they'll eat more. They create the lab-grown perfect mix of fat and salt to make that kid want to eat more. They have put the colors in, that are neon blue. And they've researched, and this has come out, that they've done focus groups with 5-year-olds, and when the color's a little bit brighter, they eat 20% more. So every single part of the food is engineered to hijack a child's evolutionary biology, because I don't think there's we're getting lectured about how this is complicated. Children that are eating whole food, children that are eating steak, children that are eating broccoli, children that are eating, delicious whole food, there's not an epidemic of obesity or metabolic dysfunction around those kids. It is so simple. And I do think it's very notable that 70% of a child's diet is ultra-processed food. And what are the components of that ultra-processed food? It is 3 ingredients that did not exist 150 years ago. We have evolved, and our body is a miraculous, interconnected system that if scientists had any humility whatsoever, they would say we have no clue what's going on with this beautiful interconnected system of our body. But we have done a massive uncontrolled experiment where the majority of our diet is comprised of seed oils. A lot of discussion about that, but that is 80% of US fats today. It was 0% of US fats 100 years ago. We are doing an uncontrolled experiment. We have changed the main source of our calories to an ingredient that has 15 process steps, including putting it through rust remover, putting it through bleach. You can Google it. It's disgusting. So there's this discussion around how we need to be science-based, but it's an assault on common sense. Clearly, it's a dynamic that has become the top source of American calories. Processed grains. Clearly, there's a discussion we need to have about our grains in the United States. The processing, and now 80% of our grains consumption is processed grains. It takes the fiber off, and obviously those grains are often sprayed with many chemicals that our body has no idea how to metabolize, and the fiber coming off completely removes the thing that blunts the glucose impact of that grain and provides much of the nutritional value. Processed grains are a new invention in the past 100 years. And of course, processed refined sugar, really not a thing 150 years ago. And it is absolutely just weaponized in our food. And when a child eats sugar, their brain and parts of their brain light up in the exact same spaces, in the exact same way of doing an illicit drug. And we have to grapple with the fact that there is a mass addiction crisis that has been spurred by the advent of ultra-processed food in the country. We have to grapple with the moral stain on our country. And it's not blaming anyone. I think everyone is on their journey. I've been on my journey. But when 50% of teens are overweight or obese, that's a moral stain on the country. It's 3% in Japan. There's something uniquely wrong happening in our culture and with the incentives and the trillions of dollars of incentives when it comes to our food. We get 3,000 less steps on average here in America than in many European countries. We clearly have something cultural. We have something that's been through our invisible hand of incentives that wants us sick, which it does, to get us moving less. Children at an average school in the United States get less time outside in the sun than a maximum security prison. So there's clearly something about our culture where we are not spurred to move. Exercise, we only started getting obese when we started having gyms pop up everywhere. In Europe, they don't have as many gyms. There's something about our daily lives and our daily culture where movement has been assaulted, and I think that's very important. Obviously, environmental toxins, and I think it is so positive, and I do think this is really worrying industry, that complaints that have happened a lot on the left are now happening with people on the right, with Maha moms on the right. And there is obviously a grappling we have to have on environmental toxins. Now, what does that mean? These are chemicals. There's 80,000 novel chemicals that have been introduced into our environment, that get introduced into a child's body, that have been created in the last 50 years. 80,000. There's new introduced every day with very little regulatory oversight. Now, these chemicals make up many things in this room. They make up many advantages of modern life. They make up the clothes we wear. They make, they're put into our food. the reason this is complicated, again, the reason I think we should be admiring the Trump administration, Bobby Kennedy, so much is there isn't a simple answer here. I don't think we'd give up a lot of the rubber on our tires. I mean, there's so many areas that these chemicals go into that we would not want to give up, but it is also undeniable we have to grapple with these unknown substances that are impacting our cells. And there's been a lot of discussion around pesticides, and I've been meeting with large farmers. 99% of corn is sprayed with glyphosate. They argue that if you do anything rash to pesticides, it would destroy the U.S. agriculture system and it would lead to mass food shortages. And that actually might be true in the short term, but I think that actually isn't an argument to not talk about it. It's an argument why we have to talk about it. We have to talk about our farming practices, and we have to talk about the truth. There's such an effort to just deny the conversation itself, and I think that's a vital, urgent conversation. And then over-medicalization. Some of you probably heard from Dell earlier. I mean, this is obviously a vital concept. I helped, with many other great people, Secretary Kennedy put together the MAHA report, and I was shocked at these numbers, but you know, the injections that we put into a beautiful baby in the first year of life, in 1986 was 3, and today it's 29. You know, we were badgered about, just somewhat like the pesticides, that it's improper to even ask a question about our schedule. This shocked me. And in Norway, they give kids today half as many shots as they do in the United States, half as many injections. So we don't have any idea what I mean, the ability to not ask questions, and this is just the truth. For all the lecturing we get on following best standard science, there is an absolute stage 5 level assault on any scientist from asking questions about vaccines and the other drugs that go in our body. Up until last year, somebody would lose their career for asking a question, and the US government put out a report, which I found very significant, where they said we must be honest, we must investigate vaccine injury, and we must empower scientists to do science and ask questions on the important topics, but most importantly, taboo subjects. And we must return science. When you get wider than that, clearly there's a problem with that 4.9 billion prescription number I mentioned. And I do think we need to unwind this idea that heart disease is a statin deficiency, that diabetes is a metformin deficiency. The problem isn't just that the drugs actually have profound negative impacts on our metabolic health, which complicate other issues. I think the core problem with drugs for chronic disease is they're a moral hazard and trick us into thinking we're doing something when, if we're still ingesting the same toxins, whether we're still eating the same food, whether we're still sedentary, we're doing nothing to address the reason our cells are crying out for help to begin with, and we will inevitably lead more suboptimal lives. I hope this overview of some insights from DC really just empower you. I know you guys are on this journey, and I'm so excited to engage with you throughout this conference. But your core intuition, your core gut feeling, it's right. It's right. And when it comes to chronic conditions, you guys reading books, listening to podcasts, I strongly believe in getting blood tests and understanding and going on a path of curiosity to understand what your symptoms mean, understanding your nutrient deficiencies, figuring out how food, how supplements, how getting outside more, how getting off some drugs can help that. We're all beautiful, unique beings, and we have the ability to understand what's best for us. There's no animals in the wild that have chronic obesity or diabetes rates. We're born with unique intuition. And I just hope some of this insight from DC empowers everyone in their journey. And I can tell you, Secretary Kennedy's fighting extremely hard to change the world. So thank you so much. Thank you.